Hi, my name is Brenda May, and I have multiple sclerosis. About a year ago, I was diagnosed with MS. My beginning symptoms included fatigue, muscle weakness, spasticity, impaired sensation and coordination, pain, visual disturbances, and bowel and bladder dysfunction. It seemed as though everything was going wrong at the same time. I went to see the doctor, and after undergoing 2 MRI scans, lesions in the brain scan were found, which led to my diagnosis of MS. Being diagnosed was a relief because I finally knew why I felt so ill.
Multiple sclerosis is a progressive disease of the central nervous system, which consists of the brain, spinal cord, and optic nerves. This disease affects more than 2.1 million people worldwide. Multiple sclerosis is caused by a destruction of myelin sheath or the protective layer covering the nerve fibers. Being either an autoimmune or viral origin, multiple sclerosis results in a diminished or loss of signaling capabilities from the central nervous system, which can lead to visual disturbances, loss of sensation, limb weakness, bladder and bowel dysfunction, mental changes, depression, and muscle spasms.
Multiple sclerosis really affects my daily life. Sometimes I'll have tingling in my left hand and then my right hand. My vision gets really blurry, and sometimes I can't even see. My legs hurt a lot. They're always stiff, and sometimes I can't even bend my knees. I'm currently on a lot of medications: oral prednisone, a corticosteroid, imuran, Avonex, a beta interferon to slow the progression and reduce the severity of my attacks, and physical therapy to make it easier for me to do daily tasks. I'm also taking medication prescribed for my depression and urinary problems. I have no memory of my first 2 weeks of treatment as I was very sick. My doctor told me the reactions are flu-like symptoms, but I call them plague-like. As the medication didn't fully cure all my symptoms, I began looking for alternative treatment options. I couldn't find all the answers to what I was looking for, so I set up an appointment with my doctor.
Have you thought about Tysabri? It is similar to chemotherapy. It is usually offered to those who have had multiple sclerosis for several years, but since your condition is so severe, we believe you are eligible for the treatment. However, it is highly expensive and there are several potential harms.
Given my young age and these potential risks, I don't think this is a solution for me. I read about medicinal cannabis as a treatment. Would this be an option for me?
Hi, I'm Brenda's mom. Though Brenda's symptoms have worsened and her medication doesn't fully treat her pain, I don't believe cannabis is a viable treatment alternative. I've always been anti-smoking, and I just don't trust medicinal cannabis.
After discussing treatment options with my doctor, I decided to begin using medicinal cannabis to treat my MS. Immediately, I began to see a difference that medicinal cannabis made on my pain from MS. My spasms lessened, I felt a lot less pain, and I focused better.
I've now seen how cannabis has improved Brenda's quality of life. As her pain is subdued, she is more aware. She is even able to hold a conversation while looking me in the eyes. Brenda is a different person after using cannabis. She becomes more like the girl I remember before she was diagnosed with MS. I know my child so well that it's not hard to notice the differences. Seeing her feel so much better, I have to support her use of medical cannabis.
Medical cannabis should not be prescribed to treat pain from MS. There's a lack of supporting evidence for its long-term effects.
Cannabis is valuable for treating pain in cases such as multiple sclerosis. Evidence exists on the effectiveness of cannabis in decreasing pain and muscle tightness. When professionals say there is no evidence, they are referring to no current evidence on the long-term effects of using cannabis. Medical cannabis has been shown to be effective at reducing pain and muscle spasticity from neuropathic disorders and multiple sclerosis. The side effects associated with cannabis are of low risk and may include fatigue, dizziness, and gut problems. Serious complications are rare and are not usually reported during use of cannabis to treat pain from multiple sclerosis. Medical cannabis is still a controversial treatment option. Experts disagree as to its effectiveness and role in treating multiple sclerosis. Tell your doctor about your medical condition and all medications. As with any medication, consult with your doctor before beginning any medical treatment.
Double, don't worry. Be happy. Don't worry. Be happy now. worry. Be happy.